Well, this week Hannah and Carlie and I learned about rickets. So the causes for rickets include having a lack of vitamin D, calcium, and phosphorus in your diet, and so that leads to your bones becoming weak and becoming very soft. This is most commonly found in children because it is really important to have strong bones, and so if you don't eat the right things as a child, your bones are going to become weak. This is usually found in children that come from poorer families and those type of communities, but it's also very commonly found in third world countries because they don't have the money for proper fruits and vegetables and proteins, just stuff like that, and so that's just kind of why those children kind of suffer from that. Symptoms include delayed of growth, as well as delayed use of motor skills. They also have pain in their spine, pelvis, and legs, which also causes their muscles to become weak. So again, it really comes back to what are you putting into your body. And so if you aren't eating the right things, you aren't going to have energy to just kind of be a normal kid. And that really does have an effect on your whole body systems. So we talked about the growth plate on the end of your bones, and so that affects the growth. So then they won't grow straight, but they'll become curved, as you'll see on the next slide. So then because they don't go straight, then your legs are going to be bowed, and then your wrists and your ankles are also going to be thickened, and then your breastbone is going to be projected out. So as you can see, they're curved, and that is just not stable for you to walk around, and it's just, you're going to have a lot more problems long down the road, just besides improper bone growth. So your diagnosis, you have a physical exam, and you check for tenderness and pain by slightly pressing on the bones and just kind of pressing on them and looking around. You also want to observe the weak and soft parts of their bones, ask about stunted growth. That's why measuring for their height and weight is super important as well. It's also important just to ask them questions about their lifestyle, what they eat, and just stuff like that. You can also do blood tests, and so then you just obviously check for levels of calcium phosphate. You do bone x-rays. You can also do a biopsy, but that's just in rare cases. So treatment, you take calcium, vitamins to promote osteoblast activity within bones, and then vitamin D helps with absorption of the calcium because calcium makes your bones strong. That's why as little kids we're always told to drink glasses of milk. So calcium and vitamin D through supplements of foods such as fish, liver, milk, and eggs. Those are really good sources for those nutrients. And just to be outside, the sun is really helpful for that. And then children with skeletal deformities may not have braces in order to have bone surgery or to position bones correctly. So that's why we wear braces, but sometimes that's just not an option. So then you have surgery. So usually there are ways to fix this. It just really depends on your financial situation and where you are. But if you have this problem in the States, there's definitely help to do that. But in a third world country, there really isn't. It's just about eating the right foods, taking medications if that's possible. But usually you can live a healthy, normal life with this disease. It's a little bit harder, and it's kind of difficult. And that's it.